So, beside what other foods in the body can actually cause an increase in endotoxin? Beside maybe eating the wrong foods you've talked about, eating maybe undercooked cereals and things like that. Of course, unsaturated foods with unsaturated fatty acids.
The things that are high in phosphate have some of the overlapping effects with the inflammatory things. Calcium, if you have a high ratio of calcium to phosphate, calcium happens to suppress the fermentation of fiber and starch in the intestine. High calcium intake will actually reduce the production of the endotoxin as well as reducing the consequences of your reaction to the endotoxin. The saturated fats, having some fat in your food does various things that can be helpful. There's a germicidal effect of the fatty acids that helps to keep the intestine sterile, and you should be able to absorb your fat by roughly half to two-thirds of the way down your small intestine where it's still sterile. But if you eat fat with a fiber, the fat helps to suppress the bacteria, and it can help the fiber persist and go all the way through your intestine. So it can turn what would be a harmful fiber-supporting endotoxin, it can turn it into a useful sort of a bowel-stimulating bulk former.